This is a brief lecture explaining that flat feet, when asymptomatic or without symptoms like pain, are a variant of normal and really nothing needs to be done to them. Flat feet affect about 20% of the population, and for most, orthopedists agree, they are simply alright. Flat feet that originate in early childhood will either develop arches in time, usually between the ages of 8 and 10 years, or may even remain flat throughout the life of the individual. Pediatric flat feet are not at all abnormal, and in most infants and toddlers have fat pads in the bottoms of their feet, making them appear flat. It would be to the detriment of the child to attempt to supposedly correct young feet like this, as normal arch development could be seriously compromised. It's best to let young feet remain bare so that proper musculoskeletal structures can develop naturally. And if a child's feet are to be flat, then it's best to leave them alone. The American Academy of Orthopedic Surgeons, the AAOS, agreed with this. However, there are, quote, alternative, unquote, practitioners who may try to convince the parents of a flat-footed child to have their little feet supposedly treated with such things as orthotics or arch support inserts, and some may even suggest surgery. That would not only be extreme, but according to most orthopedists, totally inappropriate and unnecessary. The advice from the AAOS is to leave your children's feet alone and let nature take its course. There is nothing inherently wrong with having flat feet, providing they are not causing any discomfort. Adults with flat feet may have always had them, and most cause no problems. However, if the flat feet cause pain, then maybe it would be better to condition them with exercises to help them relax. According to Dr. Harry F. Hlavik, author of the book and founder of the California College of Podiatric Medicine at San Francisco, the Footbook, Advice for Athletes. Orthotics do not correct feet, they only correct gait. Keep that in mind if you think you should wear arch supports or orthotics to somehow, quote, cure, unquote, or, quote, treat, unquote, your flat feet. They just won't, as confirmed in the book by Dr. Arthur Steiner, Kinesiology of the Human Body Under Normal and Pathological Conditions. That book suggests that the surgical approach that could lead to a rigid foot that won't behave like a spring, as that's what the arch is truly for, to absorb shock, and if they're rigid, they won't. In summary, if your flat feet cause you to have pain, by all means check into it. But if not, then enjoy them the way they are. A New York Times article about the flat foot misinformation points out that flat feet can be to one's advantage, such as some sports like basketball, for instance. So leave your flat feet alone and don't let anyone get away with telling you that it's bad or wrong to have them. That is just not true at all. I've always have had flat feet, and they are my best friends as they never cause me any discomfort. The occupations I have had entailed hours of standing in one place, and natural flat feet really work best for that. I can attest to that fact from experience.